Group A was the TSH suppression group. Group B was the no TSH suppression group. They had a similar N. Looking at sort of baseline characteristics, they both had the majority less than total thyroidectomy, 183 in group A and 184 in group B. So of course that was not significantly different. Same about low risk categories. So 194 in group A and 189 in group B, again, no difference. What was clearly different was the TSH. And so in the TSH suppression group, they had a TSH on average of 0.07, and the no TSH suppression group had a TSH on average of 3.19. That was clearly significant difference. But when they looked at the overall recurrence, there was no difference, with 10% in the suppression group and 13% in the no suppression group, with a p-value of 0.42. And then when they looked at 5-year disease-free survival, it was also the same in both groups, 91% for the TSH suppression group and 89% in the no TSH suppression group. And again, that p-value was not significant at 0.39. So their conclusion was that TSH did not impact recurrence.